Welcome back to your Pediatric Dentist channel, Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there are any mistake in videos or shorts. In previous video, we discussed dental age estimation methods based on the technique used, which include four methods: visual, radiographic, chemical, and histological, and age estimation in prenatal period. The method based on the age, which count the cross striation from the neonatal line and find the exact age of the baby in days. Today we will discuss other methods of dental age estimation in children and adolescents. Dental age estimation in children and adolescents is based on the time of emergence of the tooth in the oral cavity and the tooth calcification. The radiographic method is used in developing dentition when there is no evidence of the tooth emergence between 2.5 to 6 years. Many studies have concluded that the tooth formation is more reliable indicator of dental maturity than gingival emergence or eruption. Gingival emergence refers to the point when a tooth first becomes visible through the gums. However, it can be influenced by various factors such as genetics, nutrition, and health conditions, making it a less consistent indicator. In other hand, calcification follows a more consistent and predictable pattern. It provides a more reliable measures of dental maturity and consequently the chronological age of the children and adolescents. So first method is Score and Messler. In 1941, Score and Messler studied the development of the deciduous and permanent teeth, describing 21 chronological stage from 4 months to 21 years of age, and published the numerical development charts for them. These are 21 stages they describe, and this is the chart they published in Atlas. The chart is based on the histological section, which takes into account three characteristics. First, teeth that have erupted. This refers to the stages at which different teeth appears in the oral cavity. The timing and the sequence of the tooth eruption are important indicators of dental age. The second is amount of resorption of roots of primary teeth. As permanent teeth develop and prepare to erupt, the roots of the primary teeth begin to resorb. The degree of resorption provide information about the readiness of permanent teeth to emerge. And the third is amount of development of permanent teeth. These include the stages of formation and mineralization of permanent teeth. It encompasses the growth of both the crown and the root. How this method works? The first is radiographic examination. Obtain a panoramic radiograph of the patient's teeth. The radiograph should capture all the teeth, including both mandibular and maxillary teeth. Identify the developmental stages of each tooth based on the radiograph. The stages are typically categorized from the initial calcification to the complete eruption of the tooth. Then comparison with standards. Compare the observed developmental stage with the standard provided in the Score and Messler Atlas, and the Atlas contain a series of 21 drawings that depict the development and eruption of the teeth from in utero to adulthood. And the fourth is match the observed stages with the corresponding ages in the Atlas to estimate the dental age. Advantages: it's a non-invasive technique. Utilize radiographs which are non-invasive and widely available. Standardized, provide a standardized approach to the dental age estimation. Reliable, has been validated through numerous studies and is widely accepted in forensic and clinical settings. But it has limitation that these charts do not have a separate surveys for male and female. The second method is Nola's method for dental age estimation. The Nola method, developed by C.M. Nola in 1960, is a high accurate technique for estimating dental age. It evaluates the mineralization of the permanent teeth through 10 distinct stages of development. So these are 10 stages. The 0 is absence of crypt, first is presence of crypt, second initial calcification, third 1/3 of the crown completed, fourth 2/3 of the crown completed, fifth crown almost completed, sixth crown completed, 7 1/3 of the root completed, 8 2/3 of the root completed, 9 root almost completed, open apex, and 10 apical end of the root completed. Procedure: each tooth in the mouth is assessed and assigned a numerical value corresponding to its stage of development. The total value for all teeth in the maxillary and mandibular arches are calculated separately. The total values are compared to predetermined standards in Nola's tables, which provided age estimation based on these values. Here is the article in which Nola gave the standard charts to compare. Score and Messler's chart don't have separate standard for boys and girls. Nola's standard chart has a separate standard for boys and girls. Advantages: accuracy, one of the most precise method for dental age estimation. Sex specific, provides separate standard for boys and girls, improving accuracy accuracy, reliability, widely used and validated in dental and forensic research. Limitations: radiation requires X-rays, which means exposure to a small amount of radiation. Expertise needed. You need a skilled professional to interpret the X-rays accurately. Variability to development can vary due to the genetics and other factors which can affect accuracy. The third is Morris, Fanning and Hunt method. It is also known as the MFH method. MFH method evaluates the development of the teeth through 14 stages of the mineralization for both single-rooted and multi-rooted permanent teeth. The method primarily uses intraoral periapical radiograph of the mandibular canine to determine the age. These are the stages, 14 stages. So stage 0, no calcification, 1 initial calcification, 2 enamel formation begins, 3 enamel formation continues, 4 enamel formation completion, 5 dentin formation begins, 6 dentin formation continues, 7 crown completion, 8 root formation begins, 9 root formation continues, 10 root completion, 11 open apex, 12 apex closure begins and 13 apex closure continues. And the 14 is apex closure complete. Advantage is accuracy. The MFH method provides a high level of accuracy because it is based on a large sample population and statistical analysis. So they use a mean age which is derived from the large sample size. Basically collected large population sample and applied stages for the mean age calculated from the collected sample. Detailed stages. The method includes 14 stages of mineralization allowing for a fine-grained assessment of dental development. Standardized approach. The use of mean age ensures a standardized approach to a dental age estimation, making it reliable and consistent. Sex-specific data. The method can be adopted to include separate standards for the boys and girls, accounting for differences in dental development between sexes. Limitations. It requires radiograph which involve exposure to radiation. Genetic, nutritional and environmental factor can influence the timing of the tooth development, leading to the variability that might affect the accuracy of the age estimation. The method is more complex and time consuming compared to simpler age estimation method, require detailed analysis and interpretation, and the accuracy of mean ages depends on the representativeness of the sample population. If the sample is not representative of the general population, the mean ages may not be accurate for all individuals. The fourth is Cameri's method. Cameri's method is a technique used to estimate the dental age of the children and adolescents based on the analysis of the development of the permanent mandibular teeth. This method focuses on the degree of root development and the measurement of the open apices of the teeth. They gave the regression equation for dental age estimation. Here is the procedure how they form the equation. So first, selection of the teeth. 7 left permanent mandibular teeth are used for the calculation. The teeth are examined using radiograph to assess their developmental stages. For teeth with incomplete root development, the distance between the inner side of the open apices is measured, and for teeth with the 2 roots, the sum of the distance between the inner side of the 2 open apices is taken. Normalization. To account for the magnification, the measurement of the open apex or apices is divided by the tooth length for each tooth. These normalized the measurement are used for the age estimation. Calculation of dental maturity. The dental maturity is calculated as the sum of the normalized open apices and the number of the teeth with the complete root development. So here is the regression formula used to estimate the age. So age is equal to 8.971 plus 0.375 G plus 1.631 into 5 plus 0.674 NO minus 1.034 S minus 0.176 S NO, where the G is a variable equal to the 1 for the boys and 0 for the girls. Then S is the sum of normalized open apices and NO means the number of teeth with the root development complete. Advantages: accuracy. Cameri's method is considered highly accurate for dental age estimation, especially when compared to the other methods. Then non-invasive. The method uses radiographs which are non-invasive and widely available in dental practices. Standardization. The method provides a standardized approach to age estimation, making it reliable and consistent across different populations. Applicability. It can be applied to both living and deceased individual, making it useful in forensic odontology. Limitations: radiation exposure. Although minimal, the method requires radiographs which involve exposure to radiation. Population variability. The accuracy of the method can vary across different populations due to the genetic, nutritional and environmental factors. Complexity. The method requires detailed analysis and interpretation which can be time consuming and requires expertise. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursdays and Sundays. Also, we try to put MCQs according to topics on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.